Welcome to week 14. We only have 2 weeks of content left. Crazy. This week and next week. The first part of this week, we'll be focusing on individuals with visual impairments. We are going to start this week with definitions. The first one is visually impaired. So an impairment in vision that, even with correction, adversely affects individuals' educational performance. Legally blind. So if somebody is legally blind, it means they have a visual acuity of 20/200 or less in their better eye with correction, or a visual field that is no greater than 20 degrees. Functionally blind is just the educational description of when the primary channel of learning is through tactile and auditory means rather than visual means. Low vision is a visual impairment that interferes with the ability to perform daily activities, and in which the primary channel of learning is through the use of prescription and non-prescription devices. And deaf blindness is a concomitant hearing and visual impairment. It causes severe communication and other developmental and educational needs. A student who is deaf blind cannot be accommodated in special education programs solely with children with deafness or children with blindness. For this slide, I'm just going to put a link to the YouTube video in our introductory page for the week. I am not by any means an expert in how the eye works. So this video is just a short 3-minute clip. It's very good at describing the functionality of the different parts of the eye and how the eye works. When I tried to do a screen record, I couldn't hear the video very well. So go back to the introductory page for the week and click on the link and give it a watch. There are currently 62,000 students in the United States receiving services under the disability category of hearing impairment. Children are eligible for special ed services according to the amount of vision loss and if the vision loss affects the educational performance. So just because a student has vision loss doesn't necessarily mean they're going to need special education. So it really depends on the severity of the vision loss and how it affects them in the classroom. And the most common visual impairments are cataracts, glaucoma, optic nerve atrophy, myopia, albinism, an eye injury, a cortical visual impairment, or a retinopathy of prematurity. A very brief history on individuals with visual impairments. The first school for people with vision loss was opened in 1784 in Paris. Louis Braille, which should be a name familiar to you, was a student at that school and invented the letter system, which are embossed dots, which is adapted from military codes and is still used today. So the Braille system is generally what people with vision loss use to read. The first schools for the blind in the United States were the Perkins School for the Blind in Boston, established in 1829, the New York Institution for the Blind, which was in 1831, and the Overbrook School for the Blind in Philadelphia, which opened in 1833. These schools were basically a type of experiment to see if people with disabilities could learn to function in society. If we recall a couple chapters ago when we talked about the first special ed schools, basically they ended up becoming isolated individuals who just stayed in institutions rather than participated as citizens in society. So these schools were more of an experiment to see if they could function outside of the school walls. Children in these schools were educated on vocational skills and daily life skills. In the early 1900s, children with visual impairments were serviced in either hospitals, residential centers, or rehab centers because there were no laws or mandates stating that they needed to be educated in schools. In the 1950s and 60s, the parents started a movement for rights for children to be educated and for more educational placements for the children, seeing as there were very few schools open for educating kids that had visual impairments. And then in 1975, of course, PL 94142, which is the early IDEA, required schools to identify children in their communities that were visually impaired and to service them. This had children being placed in the general education setting with their peers, which obviously IDEA is still around today. Students can receive specialized vision services in their least restrictive environments. Most visual impairments are indeed genetic. There are some things that can be done to prevent visual impairments for babies, so good prenatal care. So if there is a parent that has an STI, that is a lot of times passed to the baby through birth. So if the doctors are aware that the mother has an STI, they generally will do many different things to prevent the baby from also contracting it. Premature delivery and hereditary conditions can also be prevented or controlled. And then screening of babies in the hospital is also very important um, in catching things early. So early detection is key to successful outcomes, just as it is with any other disability. And consistent eye exams can help to detect issues early on. So in all of your baby's medical appointments, they will look at their eyes, look at their vision, and then once students get into school, we do vision screenings starting in 4K. The book gave a pretty thorough list on some characteristics in vision functioning problems of students in the classroom. I'll just read off a couple of them. Unusual turning of the head, body, or eyes. So students with visual impairments, if they have some sort of sight, might be seeing out of different parts of their eyes. One of the students I worked with had a condition where it was like her eye was like Swiss cheese, so she could just see out of different holes in her eye, like a slice of Swiss cheese, basically. So she would often turn her head to be able to focus on different materials better. Excessive rubbing of the eyes to try and get their vision clearer. Frequent eye pain, frequent headaches, confusion in writing letters and numbers appropriately, difficulty with color identification or color coordination, failing to make eye contact when talking to people, and potentially some behavior problems. Generally, children with vision impairments have similar intellectual capabilities as their peers, which is why not all students who have a visual impairment will require special education services. When you think about how children socially learn how to interact with each other, a lot of that is through watching others interact. So when that sense is taken away from children, they're going to need some sort of specialized education, specialized training in the areas of being social with others. So when you think about talking to somebody, maintaining eye contact is something that is important. When that is gone and that is taken away from somebody, sometimes their social interactions are, not as effective as others. Smiling at somebody, reaching out to touch somebody, those are not innate skills for children who cannot see. So they're going to need specialized instruction in how to navigate different social situations. Children that have visual impairments also have some stereotypic behaviors like hand flapping, head weaving, twirling. Those also may lead to more negative interactions with others, negative attention, and social isolation from their peers. Travel skills. So depending on the level of visual impairments that a child has, they may travel with a cane, a seeing eye dog, or a sighted guide. And obviously, they will require training in any of those areas. So that is called orientation and mobility. And vocational skills, those are taught starting in birth to 3 services. So dressing, eating, daily life skills. Students must know how to bathe and dress and plan travel details. If you think about getting a job in the future, those are all very specific skills that people need in order to get a job. Expanded vocational skills are taught the further the child gets through their education and continues throughout life. When it comes to assessing individuals with a visual impairment, first and foremost, the assessments will come from the doctors or ophthalmologists. So they screen, obviously, babies all the way up through school age kids for any form of visual impairments. And then when that comes through, we usually get a referral from the doctor at the school to do further assessments for the children. A functional vision assessment is the next assessment that takes place because that evaluation needs to be performed before all other educational evaluations. That is so that we can ensure that the student will have access to the materials and equipment needed to participate and perform to the best of their abilities. They have to be able to use the materials and equipment in order to take the educational assessments. A learning media assessment, so that is the materials and methods a student uses in communication with the sensory channels in the process of learning. And then after all the assessments are done, we have an educational planning. So many students with visual impairments don't have academic goals because academically they are on par with all of their peers. So a lot of the times our program is more based on functionality of tools and learning how to um, socialize with their peers and learning how to use different tools to either access their environment or access different tools in the classroom. 68% of the students with visual impairments are educated in the general education classroom, so that's a huge percentage of the kids. So things that we need to consider, students with visual impairments need to have both the general education curriculum and the expanded core curriculum, which includes assistive technology, career education, compensatory skills, independent living skills, orientation and mobility, recreation and leisure skills, social skills, and self-determination skills. Book covered some tips and tricks for working with students who are visually impaired. So do feel comfortable using vision words such as look, see, and watch. Do use the pupil's name when addressing a student. Do read aloud when writing on the board. Encourage independence. Include the pupil in all class activities as feasible. Give explicit instructions. You may need to repeat them a few times. Provide extra space for storage of equipment and specialized materials. Encourage the use of supplementary devices when necessary. Orientation and mobility, so that's a related service in an IEP. Generally, schools don't have somebody on staff who can teach the skills to the students, so a lot of times they have to reach out to various CISAs or different organizations to get somebody who specializes in orientation and mobility and works with the students. Orientation and mobility teaches individuals how to navigate their environment safely independently by helping them understand their location and how to physically move through that space using techniques like a cane or a guide dog. Orientation and mobility obviously relies heavily on auditory and tactile cues. There are obviously a ton of different technology options for people who are blind or visually impaired. The book just went through some of the tech options for literacy, so a Braille embosser, a Braille translator, a Braille writer. One of the statistics in the book was that only 12% of students currently know how to read using Braille, which it used to be over 50% of students who are labeled as blind or visually impaired. So that has definitely decreased drastically over the last, 50 years. Um, there's obviously new technologies out there and different ways of being able to access information rather than just reading Braille, but it is kind of becoming a lost art. Other tech options are synthetic speech, electronic magnification, or an e-text reader. Early childhood and future outcomes. So just as it is with all other disabilities, early intervention is key to developing language, gross and fine motor skills, self-help skills, expressive language skills, and social skills. The earlier we can start working with students who are labeled as blind or visually impaired, the more successful they're going to be with their life. The goal of transitioning to adulthood is working on vocational skills and being successful in the community. Adults with vision impairments tend to become isolated from the community for many various reasons. They may require work and leisure support to stay connected. And adults with visual impairments rely on transportation, specific job training, and various accommodations and access to various assistive technologies for successful integration into the work setting.